Strokes occurs whenever the blood supply to the brain is interrupted, either through obstructions by a clot, thrombosis, or because of bleeding from the artery supply, hemorrhage. Ischemic strokes can be treated by resolving the obstructions, for example by dissolving the clots by the use of thrombolytics. Hemorrhagic clots, however, are very rarely amenable to therapy, whether medical or surgical. Regardless of either specific cause or the long-term prognosis, the immediate problem is exactly the same. As part of the brain loses its blood supply, it can no longer function. The acute symptoms may be an inability to move, speak, understand speech, or see, and sometimes the stroke is fatal. Because the two sides of the brain have a largely independent blood supply, in most cases the symptoms may be one-sided, such as the inability to move one limb or one side of the body. The case study is a 74-year-old male. He had acute stroke on February 25, 2018. His right hypothalamic bleeding and left lateral infraction. Fortunately, he had high concentration of oral intake telomerase within 36 hours. 4 days later, after rechecking, doctor claimed that the surgery was no longer needed. He was discharged from hospital after 6 days without using a crutch. Day 15, he had better physical strength and he walked better. Day 28, his physical strength was much better. Facial and neck wrinkles reduced. His facial skin tightened. Eye bags shrank. And he was able to walk for over 2 hours. Day 609, October 27, 2019. Mr. H stopped using it for a year and a half. His physical strength is not as good as before. Walks slower. But overall, his condition is not too bad.